وقتكم. تقريبا probably gonna be like 45 minutes or 50 minutes. لأن الميزة يعني بالتوك هذه إنه يكون في discussion at the end ويكون debates، خاصة معنا ترى مجموعة من الدكاترة بعلم النفس، في دكاترة من psychiatry ومن تخصصات أخرى. So this is a great opportunity, especially أيضا it's going to be recorded حق اليونيفرسيتي نفسها، الجوست يونيفرسيتي. التوبيك هذا طبعا وايد is debatable، اللي هو موضوع الفري ويل. فراح نتكلم فيه من طريقة فلسفية ومن طريقة أيضا من scientific. طبعا I'm not trying من التوك هذه اللي هو change your minds about free will، ولا أبين لكم إن إحنا we don't have any free will. بس الهدف من طبعا التوك هذا خاصة is targeted mostly يعني حق النيوكومرز حق الفيلد المنتل هيلث، إن in reality we do not choose many things، من ضمنها اللي هو mental disorders in general. Nobody chooses to have a mental disorder. Nobody chooses any suffering that the people go through. So usually the talk is about free will. والسؤال دائما اللي ينطرح اللي هو why do we want to be what we want to be؟ يعني هل هو مثلا ليش أنا والله اخترت إني أصير مثلا psychiatrist؟ ليش اخترت إني أصير مثلا doctor from the beginning and all that? Is it really a choice? Do we have really free will? Are we in control of our choices ولا لا؟ Okay. هذه الأسئلة اللي دائما يعني نطرحها، ودائما we have our students ask us اللي هل فعلا مثلا احنا do we have a free will؟ هل احنا فعلا قاعدين نتحكم في تصرفاتنا او لا؟ وخاصة يمكن مجالي انا بالforensic psychiatry، when people commit crime, are they really responsible, or do they share any some of the responsibility if they're mentally ill or not? So let's start this with a clip of a video that we did تقريبا 2 years ago. كان في حملة اللي سويناها for the mental health law. And the beginning of the video of course is long, it's about 10 minutes. So I'm just gonna show you guys the first 2 to 3 minutes. And it really tells a real story of a patient of mine when I was practicing in Canada. So you'll see the thing is it's going to be in Arabic, but later on for any audience who are not speaking Arabic, I'm going to describe the case again in English. Okay, so let's watch it.
من أكثر الحالات اللي دائما أتذكرها، أذكر patient كان عندي مريضة فيها الفصام. الغريب بحالتها اللي ليش دائما أذكرها اللي صعب إني أنساها، إن جت لنا ذبحت ولدها. كانت وايد highly functioning. زوجها كان كارديولوجيست طبيب قلب، وهي كانت أخصائية اجتماعية. ظلت بالمرض تقريبا سنة. زوجها كان رافض يعرضها على طبيب نفساني لأنه مستحيل، لدرجة أن المرض وايد تغلب عليها، اللي قامت فعلا عاشت بالأوهام اللي حست أن في مجموعة راح تي وتخطف عيالها. فمن الخوف قالت أنا أفضل أني أذبحهم من أن ينباعون حق السليفري كعبيد. وفعلا عاشت بالأوهام هذه. اللي خذت الخطوة هذه راحت خنقت ولدها عمره 6 أشهر. لما راحت حق ولدها الثاني اللي عمره 4 سنين ما قدرت، فلبستها كشختها وطلعت برا، دقت على زوجها. حياتها انتهت بسبب ان زوجها كان يدري انها هي مريضة نفسية، بس كان مستحي، فما عرضوها على الطب النفسي. دمرت حياتها، قتلت ولدها. بدش على الأقل الطب النفسي الشرعي 3-4 سنين، بعدين لما تطلع أكيد خلاص خسرت حضانتها، طلقت. كان الأصعب من كذي مو قصتها، إنما لما بدينا نعالجها راحت الأوهام، فقامت تشعر بالحقيقة. يعني أول لما كان عندها الأوهام على الأقل كانت اللي سوتها يمكن لسبب، فبدت تدش باكتئاب. فإحنا دشينا الحين بديلما، هل نعالج ولا ما نعالج؟ وإذا نعالجها راح تصير تدش باكتئاب، خلاص هي راح تدري إن أنا قدمت حياتي. وإذا ما عالجناها شلون؟ إزت إثيكال؟ هذا شيء أخلاقي؟ هذا شيء يتناسب مع المهنة؟ كل واحد فينا اللي مارس المجال هذا، الطب النفسي أو علم النفس، عنده كذي قصة يذكرها اللي مستحيل ينساها. يمكن وايد يسألوني هل المجال هذا يأثر عليك؟ إي نعم يأثر عليك. كلنا دشينا المجال هذا لأن فينا الرغبة إننا ننقذ شخص، يمكن واحد من أهلنا، يمكن واحد من أصدقائنا.
So this was a true story of a patient I had. I remember when I was practicing forensic psychiatry in Canada. So she came to us. She's actually a social worker. She's a very educated, highly intelligent person. Was in her, I think, 35 years old. And she murdered her child. She had 2 kids. She killed the first one, and she couldn't kill the other one. She was contemplating the whole thing. She had delusions. She lived in the delusions for almost a year and more. The funny thing is that her husband was a cardiologist, and he hid the facts, and he knew that she was psychotic, and he didn't take her to any psychiatrist. And of course, this is happening in Canada, and we believe, of course, I mean, there's less stigma there in Westernized society, but in reality, it's not. The stigma is everywhere. Just mind you, I mean, we're living in a conservative society, and of course, I mean, the stigma is much more in here. So the interesting thing, of course, I mean, when we saw her, she was completely delusional, and she had very weird delusions that her kids were going to be sold to slavery, and she needed to protect them, even to kill them, rather than, I mean, to let them suffer. So she did what she did. And later on, of course, I mean, we say that she's not responsible because of the mental disorder she had. It was schizophrenia. And she was admitted to the hospital, and then we started treating her. But the thing is, after treatment, she started to regain the insight, and then I mean realized that everything she did was basically based on delusions. So she lost her family, lost everything, and now she's stuck in a hospital. She cannot see anybody. She cannot see her family. So we had now the dilemma. I mean, should we treat or not treat? Because I mean, if we're treating her, of course, I mean, she's going to go now into depression and that. If we don't treat her, she's going to continue to have the psychosis. So ethically, we have to treat, right? So of course, I mean, we have to treat at the end, but offer her the best of care and psychotherapy and all that. So the question, of course, I mean, comes to you, the audience. Is she responsible or not responsible? I think, I mean, the logical question would be, she's not responsible because, of course, I mean, she had delusions, and she killed her son because of the delusions she had. But what if I tell you that actually she knew about the illness and she refused the treatment intentionally? And this is not uncommon with many of our patients that we see. We told them that you guys have a mental illness, so you do need the treatment. If you don't get the treatment, the delusions will become worse and worse, and the voices and all that. So in her case, she knew, and she was told about her illness, okay? And she didn't take the medication because she didn't believe that she needs the medications. So is that gonna change anything now? Would she become now responsible? If we say that, I mean, she knew about the illness and that? And what about the husband? I mean, the husband is a cardiologist. He's a physician. Should he take, I mean, some of the blame for what happened to her? In reality, I mean, we don't, of course. I mean, nothing happens to the people around the perpetrators and about around the victims, right? But in his case, I mean, was directly involved in the whole thing. He knew about the whole thing, and he didn't do anything about it. Okay, so and nothing happened to him. This is a case that happened in Kuwait that we saw him 2 years ago in the hospital, in the mental health hospital. Interestingly, this patient, he did suffer from schizophrenia, and he thought that the neighbors were spying on him. They were sending him gases through the AC. They were harassing his family and all that. And he took actions. He went to police stations a number of times. He even went to the Human Rights Society, and he went to a number of newspapers telling them his story. Of course, I mean, most of the newspapers, they refused to publish his story, except one, Siyasa, which they published his story. And interestingly, when you read his story from his perspective, you feel the amount of suffering. Of course, I mean, he was delusional. He was saying how the neighbors were following me, following our family, and all that, and they're trying to harass me and everything. But he was living in that delusion, to the point that he changed his house a number of times. And sorry, do you guys hear me? Because someone said that it's mute.
No, we can hear you, Doctor.
You hear me? Okay, okay. Because I just received a message from someone saying that it's a mute. Okay. Yes, so basically he changed his house a number of times, thinking that there is the issue with the neighbors, but the issue basically persisted. So in reality, the issue is really, I mean, with him having the mental illness. So what happened, how he came to us, that one day he had enough of the situation he's having. Nobody basically, I mean, gives a damn about him, the police or all that. I mean, they tell him that you're crazy. Then what he did, he was driving back from home, from work, going home, and he saw two of his neighbors outside his house. He believed at that moment that they were really planning to do something, so he decided to just rush into them. Okay. Luckily, they didn't die, but they were admitted to the ICU in critical conditions. So he came to us, and when we saw him, we told the public prosecutor, this guy, he is really highly dangerous. He is not responsible, and he should be admitted in a psychiatric facility. What happened? Unfortunately, he was let go. And, the whole case was dropped. And after 6 months, he came to us again, stabbing a colleague of his at work. Okay. So in his situation, and then after that, of course, the public prosecutor did take the action to admit him. And interestingly, after a few months of treatment, he became very well. I'll tell you another interesting example of this about the mental disorders and that about criminal responsibility. There was a famous case, Charles Whitman in 1966. He killed his own wife and mother. He opened the fire tower at University of Texas, killing 16 people. The story was all over the news in the States. Interestingly, that guy was happily married. He did see a number of doctors complaining of severe headaches and violent impulses. And the note he left was beside his wife. He said, "I cannot rationally pinpoint any specific reason for killing her. Let there be no doubt in your mind that I love this woman with all my heart." And his suicide note requested an autopsy for his brain and that all his money be given to mental health. Interestingly, what they did find in the brain imaging, they did find the glioblastoma. pressing on the amygdala. And we know that the amygdala, this is the region basically what causes the impulsive behaviors, the anger, and all that. So an hyperactive amygdala results a person to become very impulsive and aggressive. So let's assume that Charles was not dead. And if he would come to us with all the investigations and all that, and really, I mean, seeing from the case that he had a brain tumor pressing on in the amygdala, so maybe really, I mean, his impulsive behavior was because of the tumor. So in this case, we would say that he is not responsible. However, it's not that easy. So because if we see his life longitudinally, there was a clear history of abuse, that he was abusing his wife all the time. There is a history of child abuse. He threatened a colleague before, and his brother murdered at the age of 24 in a bar fight. So there is clearly some violence in the family itself. So in here we're talking about the genes or the biological reasons for the criminal behavior and the environment. So now the picture is not that clear. When we say he's not responsible because of the glioblastoma, but what about, I mean, his behavior? He was always violent, right? So we should now, I mean, take those in consideration, the two things. So what is really, I mean, the reason for the killing? We cannot just say, I mean, the brain tumor. I mean, clearly he did live in a violent environment. This is the same thing that Sam Harris, the neuroscientist, he spoke about the thing about free will in his book, a famous book that he wrote a couple of years ago. Basically, he talks about the issue that saying that in reality, we do not have a free will. Free will itself is a delusion. What we have is control over the conscious, but not on the subconscious. So I have control, for example, on me bringing tea, that I'm drinking tea right now, right? But we do not have control over the subconscious. That why did I choose tea and not coffee? Why is it that, for example, I don't like coffee? Is it really a choice? I mean, most of my friends, for example, they like coffee. They like to go to Starbucks and that. Or they go to other cafes, but not me. Why? Can I change that? Is that really, do I have control over that? What about our interests and desires? Why do we, for example, I mean, choose a certain type of a partner, not anything else? Do we have control over that? So in reality, I mean, you're saying that free will in general is actually a delusion, that we think that we have control over the thing that we do, but this is just a small percentage of the control that we do in our lives. It's only on the conscious level. It's not on the subconscious. And biologically, this also very true. For example, we all know that anger and fear activates the amygdala. As we were talking about the amygdala, this is the region of the brain that usually gets activated with people with anxiety, when we see something very frightening, when we're angry. PTSD, post-traumatic stress disorder, people with that, they usually have overactive amygdala. So their amygdala is always active. And the opposite is true for the frontal cortex. So the frontal cortex is like that region of the brain, the frontal, this is the last region of the brain to mature. That's what controls the amygdala. So people with anxiety in general, the frontal cortex is hypoactive, but the amygdala is really hyperactive. Interestingly, even with a number of tests that have been done, that sniffing terrified sweat. So if you are in a room, sitting in a room with people who are terrified, and you sniff, you smell their sweat, even though if you're not terrified yourself, your brain starts thinking that you are terrified. So you start becoming terrified. So this is happening on a subconscious level, okay? As we were saying, the frontal cortex is the last to mature. and usually has a high metabolic rate. That's why it needs a lot of glucose. So when a person, for example, becomes hungry or working too much, interestingly, becomes more aggressive and more prone to lie and less charitable, becomes less empathic. Interestingly, that's why, for example, like in some religions, even the past, for example, in Islam, they would say that the judge should not, for example, work if he's hungry. I mean, that was a good observation because, yes, I mean, people when they are hungry, they become really, I mean, less empathic and more impulsive, and they reach their decisions quickly without good judgment because the frontal cortex is really not functioning very well. And when we have a damaged frontal cortex, just like one of the famous cases like Phineas Case, usually people with that, they become very childlike people, become impulsive, disinhibited, aggressive. They would say, their families usually, they would say that they're completely different. And we see that in some patients with dementia, like frontotemporal dementia, that usually the families, they would say that they're completely different. They start to become like children. They eat a lot of cookies, they love carbs, they love bread, they're so disinhibited, they're very sexual and all that, just like kids. So, because a damage of the frontal cortex. And interestingly, I mean, this is a question to all of you guys. Do you know anyone who is around you in family, friends, who is impulsive, reckless, self-destructive, selfish, risk-taker, emotional, always wants to be different? The answer is actually all of us, especially when we were adolescents, right? Because, I mean, this is the time when the frontal cortex is not mature. So usually the frontal cortex matures at mid-20s, usually at the age of 25, 26, 27. So that's why, I mean, looking back, we think of our times when we were teenagers, that we did, I mean, some really stupid things. I would say, what was I thinking of, right? But in reality, yes, biologically, because our brains was not mature enough. So we were born actually to do really impulsive behaviors. Interestingly, also, I mean, a number of studies were done on this, that Gao, for example, in 2010, studied electrodermal fear conditioning in 1,800 3-year-old children. So what he did, he collected a number of kids, and he put this electrodermal like sensation on their skin to test their sweats and test their pulses and all that. And they, so while they were sitting, they made a very loud noise close to them. So they were measuring, for example, how afraid and terrified they get when hearing the noise. Interestingly, he followed all those kids later on, after 20 years. And those who were not showing a lot of fear, they're the ones who were basically more prone to do more crimes. So this thing then, I mean, it starts at a very young age, that we can really, I mean, predict when people, they go on into criminal behaviors and all that. And this is, for example, when they talk about psychopathy, antisocialities, conduct disorders, and that. It really starts at a very, very young age, okay? Also, I mean, in the, chemically, we know there's a lot of studies, for example, they say that when we have low serotonin, people with low serotonin, they usually become more impulsive, especially suicidal. Suicide really increases in people with low serotonin. Low dopamine, on the other hand, makes people very addictive, risk-taking, sensation-seeking. If we have high testosterone, we become impulsive and aggressive. Although, interestingly, this is not very clear. It's not like when it's in animals. In animals, it's a very clear link. If we increase testosterone, the animal will become aggressive. However, this is not very true in humans. In the humans, environment really plays a big part of it. So if we increase testosterone in a criminal person, we have a recipe for disaster. But if we increase testosterone in someone who has, for example, never committed a crime, that doesn't mean he's going to become a criminal. So the environment and the behavior of the person really does basically, affect whether testosterone would work or not. The same thing with oxytocin. Oxytocin, this is the love hormone. So if we increase oxytocin, person becomes less anxious, reduce fear, and increase actually charity and empathy. But also this is environmentally driven. So that doesn't mean that if we give oxytocin to criminals, they're gonna be loving and caring people. But if we increase oxytocin to good people, they will become even better. So environment really plays a big part. So not just the genes and the hormones and all that, okay? And in reality, genetics play a major role in almost everything, in IQ, in cognitive functioning, in autism, ADHD, depression, anxiety, bipolar, schizophrenia, addiction, you name it. Even sex offenders. I remember when I was practicing in Canada at a sex offender clinic, of course, coming with my prejudice and all that, and like assessing pedophiles and rapists and the whole. The first thing was having some judgment against pedophiles. And the first day, I remember my supervisor back then, Scott Woodside, he told me, Mohsen, nobody chooses to become a pedophile. Nobody chooses to become hated by every single person in community, being hated by his family and friends of that. Yes, they're responsible on the act itself, but they're not responsible on the desire, on the interest they had. So in reality, we should treat, we should rehabilitate rather than we punish. And that's why, for example, a number of countries now, Scandinavian countries and that, they're really reducing the amount of punishment on jail and all that. They're focusing more on rehabilitation. Okay. This is another interesting video I want to show you, talking about also, the role of genes in our behavior and personality.
This is the sleepy island of St. Kitts in the Caribbean. 300 years ago, velvet monkeys were brought here from West Africa along with slaves serving the rum industry. Escaped monkeys acquired a taste for alcohol by eating fermented sugarcane left in the fields. Today, they satisfy their thirst by raiding local bars. They have learned to be sneaky. Picking the right moment is everything. For years, the monkeys have been studied for insights into our own drinking habits. Just as we vary in our taste for alcohol, so do the monkeys. Some do anything for an alcoholic cocktail. But just as some people are teetotal, so are some monkeys. These reject alcohol in favor of soft drink. Significantly, the percentage of teetotal monkeys matches the non-drinkers in the human population. In line with human habits, most drink in moderation. 12% are steady drinkers and 5% drink to the last drop. The similarity between us shows that a liking for alcohol is determined mainly by our genes. After each daily raid, Other human parallels soon appear. But unlike us, monkeys that are heavy drinkers make better leaders, respected by other monkeys. They seem to tolerate leaders that monkey around. Like monkeys, our taste for alcohol began when we scoured the forest for ripe fermenting fruit. Food and alcohol became linked with intoxicating effect.
دكتور فجر, I think some people are يبي يدخلون with the men.
موجود دكتور.
Yeah, okay.
The waiting room is open in front of me, so I can't see anyone.
Okay, so maybe it's an old message. Yeah, so interestingly, I mean, of course, even, I mean, the studies that show that it's not just humans, even animals, they have genetic differences between them, for example, like in the case of addiction. So, I mean, we sometimes, I mean, we do have a big judging behavior towards addicts, and we believe that addiction is really a choice, but in reality, addiction is also, I mean, a mental disorder that people do not choose to become addicts. So that's why the focus should be really, I mean, towards treating them rather than, again, punishing them. So interestingly, for example, in the research of the monkeys, that they were saying that the percentage of alcoholic monkeys, they're very similar to the percentage of alcoholic people. And most they drink in moderation, for example, and just a few percentage, they drink to the last drop. So just like humans. And some, they don't even like the taste of alcohol. Again, very similar percentage to humans. So the role of genes is really very strong, and we shouldn't basically, I mean, downplay it. A very interesting test that showed this mechanism of genes and environment was a test called the marshmallow test. It was done by a Stanford psychologist in the 60s. So what they did, the examiner basically, he left a marshmallow with a child. So most of the kids, they were between 3 and 6 years old. And they told the child that you can have the marshmallow, or if you wait until I come back, you will have 2 marshmallows instead of 1, okay? Interestingly, they were basically examining how much those kids were able to delay this gratification. So a number of kids, they didn't even wait for the examiner to leave the room. They just, right away, they had the marshmallow. Some, they waited a few minutes, and some, they were able to wait for the whole 15 minutes. Interestingly, they found out that those kids who were able to delay gratification more and more, they're the ones who had high scores in school, they were less aggressive and more resilient. And what's very interesting about the study, they followed those kids in adulthood, and they found those kids who were able to delay gratification, they were the ones who are more successful, they had more prefrontal cortex activation, and they even had lower body mass index. So they were able more to control themselves. Some theories developed during that was saying that it really stems from the role of trust. So those kids who couldn't, for example, wait any minute or more, they didn't have any trusting relationship with their parents. So the care was not available all the time. It was very inconsistent. Their parents were lying to them the whole time. So when this examiner tells them that I'm going to give you 2 marshmallows, they didn't believe him because they didn't have that trusting relationship with their parents. So why would they trust a stranger, right? So they would think, I might have the 1 marshmallow better than I have nothing. Who knows that even this marshmallow gonna last? So those are the ones actually, because they had very not the best environment, interestingly, they were not able to delay gratification, and they were the ones who did not have good control over themselves. So in here, environment itself, it plays a big part on the shape of our personality and our behaviors and so on. What's even before that is the temperament. Every person is born with a temperament. Even actually animals are born with temperaments. Everyone who has a pet would say that my cat is totally different than the cat of the neighbor, or my dog is totally different than the other dog, for example, of the neighbor, because they have different personalities. So personalities, we are born with different personalities. Even the same family, I mean, brothers, sisters, they have totally different personalities. So a famous study does the strange situation. And here, what they measure basically the temperament of the children. And kids are usually born with that. Also, the environment really plays a big part of it. So in here, the Ainsworth, that's a famous psychologist, is the one who came up with the 3 different temperaments. And her student actually came with the last one, which is the disorganized. So the experiment basically is that the mother sits with a child. Usually a child is 1 year to 1 year and a half. And the child starts playing with the toys and all that. This is like a completely strange environment. And then later on, a stranger comes in. This is the examiner, and the mother leaves. Okay. And then later on, the stranger leaves, the child by himself, and then the stranger comes back, and then later on, the mother comes back. So the idea of the experiment is to see what would the child do if they're left alone with a stranger, and what would they do when the mother comes back. So a securely attached children, which is most kids who do have like a loving, caring family and environment, what they do is, of course, they're going to be a little bit anxious in the front of the stranger. And then when the mother comes back, they go and welcome her and all that. However, there are different type of kids who do not have a very secure attachment. For example, a very abusive family, inconsistent caring from the mother and that. Some, they are become avoidant. So avoidant becomes basically, they don't really care whether the mother is there or not. They don't play much, whether the mother is there, whether it's not, whether the stranger is there or not. Okay, so they usually have little exploration and little emotional response to the mother. So when the mother comes back, they don't even care whether she's there or not. And then there is the ambivalent or anxious. Also the same thing with little exploration. However, in those kids, they're very anxious. And when the mother comes, they becomes usually kind of like aggressive towards the mother, kind of punishing the mother. They start hitting her and all that, showing her, why did you leave, right? So the response would be so much exaggerated. And then there is the disorganized, which is in between the two. And interestingly, most of patients who usually go on to develop borderline personalities, antisocial and all that, they are with the disorganized, insecure children. So the attachment itself with the mother, with the family, plays a big part early on in the development of the personalities of people. Interestingly, even abortion. A lot of people talk about, for example, abortion and criminalizing abortion, and then the opposite to legalize abortion. They noticed that when abortion was legalized, the rate of a crime by young adults decreased for some reason. And the theory behind that, when the people, the kids, they know, for example, that they know that they are unwanted, so they are left to be adopted or to live in a foster home. Some of them, they do go on to commit crimes because they have so much hatred towards the society. and towards their family and all that, because they were left at a young age. Okay? So the feeling itself of being unwanted really hurts them at a young, early age. And interestingly, even, I mean, the studies that done in Romania post the dictator Ceausescu, when he banned contraceptives and abortions and requiring women to have at least 5 children. So there were a number of thousands of orphans. Interestingly, most of those orphans, they were noticed to have low IQ, poor cognitive skills, poor attachment, very high anxiety, decreased total brain size, again, especially the frontal cortex, except the amygdala, which is the opposite, becomes very enlarged and hyperactive. And of course, I mean, we know from a number of studies that show that childhood adversity increases the odds of adults having depression, anxiety, substance abuse, impaired cognitive capabilities, again, mainly frontal cortical, which is executive functioning, impaired impulse control, emotional regulation, antisocial behavior and violence, and abnormal relationship. So any adverse events that happen during childhood does affect people growing up. So again, when we talk about free will, do those people who are adults now, grown up in a very harsh environment and having bad genes, do they have really free will? Was it really their choice of what happened to them? What about poverty? I mean, with a number of studies, again, they show, for example, people in low socioeconomic status or in poverty, they are more violent, more aggressive, and that. Interestingly, there's a number of contradicting studies about that. It's actually more the subjective rather than the real poverty that matters. So, meaning that inequality, injustice. If you live in a very poor neighborhood in a rich country, we have so much hatred towards the society and you want to take revenge. And this is what causes psychological distress. Rather than if you're really poor in a very poor country, then really it doesn't matter because compared relatively to everyone around you, you're the same. So it's really the subjective feeling of poverty, of injustice, that's actually what really matters. That's what triggers people to become violent and aggressive. A number of things, again, I mean, we don't have control of, including, for example, obesity, which is really, I mean, a global epidemic, right? We always, I mean, think of, for example, obese people, that it's a choice, they're not dieting enough, they're not exercising enough. It's really, I mean, a choice of them. But in reality, a number of studies show actually otherwise. The twin adoption family studies show a big genetic factor playing a role in obesity. And children who have parents or grandparents who are obese are much more likely to become obese. 40% of children with excess weight will continue to be obese in young adulthood, and those will continue to be obese in adulthood. And interestingly, I mean, there is also a leptin resistance thing. So the more fat contained in fat cells, the more leptin people produce, and therefore people with obesity have leptin resistance. So they produce less leptin, although the brain does not recognize it. So what happens, the brain doesn't receive the leptin signal. It wrongly thinks that the patient is starving even though he is overweight. Right? So, and then hunger increased and you start burning fewer and fewer calories just to prevent starvation. So in reality, again, a number of things happening we don't have control of. So people who are obese, that's why we say it's an illness actually. They need treatment, they need help, rather than, for example, we just punish them or tell them that it's completely their choice. It's really, in reality, it is really not their choice. And then talking about violence in general, okay? So do people, for example, I mean, choose to become violent or aggressive? Right? So if we
I'd like to request the person mute themselves, please. Thank you.
So please mute your mics. So talking about the origins of violence, there's a number, for example, of theories about violence. whether it is learned, so people learn it from their experiences, from usually families. So growing up in a violent family will actually increase the risk of violence. Could be characterological, variability, quickness to anger. This is, for example, in their personality. They have impulsive behavior. Their personality, this, for example, with antisocial personalities and that, they usually use dominance to get what they want. Could be situational. For example, in those who use drugs or in specific communities. Or symptomatic. In, for example, a paranoid person who's always perceiving that people are against him, or that the whole world is against them. So this is how they interpret the world. And there is also, I mean, the social predisposition factors to violence. So we cannot just say this is more psychological, but also it is social. So socioeconomic status, as we were talking about, there's a threefold increase in economically deprived neighborhoods. So poor neighborhoods, usually the violence is high. Why? There are two theories for that, the cultural and structural. The structural theory says that it's a way that the people in poor neighborhoods, they perceive themselves against the whole society, that it is a huge fault, it's a fault of the society, making them deprived of everything. So they project all their anger towards the big society. The cultural is that it says basically this becomes the norm, that in a poor neighborhoods, that I tend to violence to get what I want, right? Also, substance use, there's a clear link with violence. So whether it's systematic connection, for example, that usually people who do use drugs, they tend to violence, or it's a pharmacological, so it's a direct effect of drugs, or economic compulsive, for example, need to steal to buy drugs. Familial environments, as we were saying, that it's a big thing that living in a neighborhoods, or I mean a family who is violent, will create basically violent kids, and peer influences actually is very high. So those who have friends who are violent, aggressive criminals will tend to do the same. Interestingly, there's also, I mean, biological predisposition to violence. So there is a localized brain dysfunction. I mean, everybody talks about, for example, about epilepsy, temporal lobe epilepsy, and its connection to violence. Also, when there is frontotemporal damages of the brain, frontal cortex abnormalities causes impulsivity and explosive aggression. Limbic system, the amygdala, can reduce again changes in intensity and quality of aggression. Interestingly, also, I mean, the changes of hormones. For example, when we have low serotonin, as we said, increases impulsivity, suicide, aggression. That's why, for example, we use SSRIs with those patients. The opposite, increasing levels of norepinephrine and dopamine, can induce aggression, and this is the role of beta blockers, for example, like Inderal. Testosterone, as we were saying, there is a positive link with aggression, mainly in animals, interestingly not in humans. And interestingly in humans, it's more increases competitiveness rather than aggression. And mostly, so when you increase testosterone in men, for example, they become more prone to compete with others. So increase also impulsivity and that. It does increase aggression in already aggressive people. So again, I mean, environment does really play a big part of this. And then there is the inherited violent predisposition. This is more like the psychopaths. And we were talking just like those who start as children, actually. And they do show some signs that even in the DSM, for example, now when we diagnose someone with conduct disorder, there is a specifier, which is close to psychopathy, that usually even those kids with conduct disorder, they have no empathy or remorse towards anything. They would see, for example, animals dying, they don't have any feelings. They don't even, for example, notice facial expressions or those fearful facial expressions. So, for example, when we see someone who is afraid, our amygdala starts to become active. Interestingly, with patients with psychopathy, their amygdala is always hypoactive. It's not active all the time. And this is even for pain or emotions. So when they see a fearful face, they don't actually show a lot of emotions. Or when even they're tortured or they feel pain, they don't show similar emotions to normal people. So there is some changes biologically in them. Also, as we were saying, this is the first thing we were talking about, reduced amygdala in psychopaths. And we talked about this, the 3-year-old children showing poor fear conditioning if they have a problem in their amygdala and the ventromedial prefrontal cortex. And also, interestingly, in ADHD patients, there's a number of studies, showing that they're really higher prone to have a criminal behavior. So they're 11 times higher of committing crimes. So in reality, do we choose to have ADHD or not? This is completely a genetic illness. And if you have the ADHD, then you have a high likelihood than others, to commit crime. So again, where is the choice in that? Talking about something different, but the same thing about, the role of genes and environment on shaping our personalities and mental health, creativity and mental disorders. And this is something also we discussed in the video that we made. I'll share it with you guys later on the YouTube. You can see it, it's 10 minutes long. The number of studies actually show that, interestingly, there is a link between the creativity and mental disorders. For example, those famous people like Mozart and Beethoven, musicians, and the writers Hemingway and Virginia Woolf, and the artists Van Gogh and Michelangelo, they all had mental disorders. In the picture down is Van Gogh, how he cut his ear because of the depression he was having. A number of studies showed, for example, that there's a greater creativity in schizotypal people, more than, for example, normal people or schizophrenic individuals. And especially there is a greater activation in the prefrontal cortex. There's a special link, interestingly, between creativity and mood disorders, especially bipolar disorders. A study involving more than 1 million people conducted by Swedish researchers found a number of correlation between creative occupations and mental illnesses. So usually patients with mental disorders, interestingly, they choose more artistic and creative jobs. A 25 study at Stanford University School of Medicine measured creativity by showing children figures, varying complexity and symmetry, asking whether they like or dislike them. Interestingly, kids, for patients, for people who do have bipolar disorders, even if they did not have bipolar disorders themselves, they kind of appreciated more the artistic figures than the very plain figures. So interestingly, yes, there is a huge, of course, debate about this, whether there is a direct link between the creativity and mental disorders, but definitely there is. Moving on, talking about, again, our choices, whether we have choices of the disorders we have, whether we have choices on the genes, whether we have choices on anything, whether we have choices on obesity or that, the same thing, we do not have really choices on the mental disorders, right? Otherwise, if we have really, the choice or the control, we wouldn't really, have a mental disorder. So the most common thing, of course, mental disorders to talk about is anxiety disorders. And usually the common question is, how can we distinguish between fear and anxiety? And what is really anxiety? And there is really a clear distinction. Fear is a normal response to a threat. For example, I see something very strange or scary, of course I'm going to be afraid temporarily. But anxiety is that when you have the fear continuously all the time, even without, for example, a legitimate or good reason. So fear in reality is good. For example, when you have an interview the next day or you have an exam and you really, your heart is pumped up and your pulse is very high, your adrenaline is rushing, and then your concentration is really high and you're focusing very well. You do need that. It is really good. However, just imagine living with that all your life. Now that becomes a problem. So, and this is really what now goes into stress. So when you have too much anxiety the whole time and you have too much stress, that's going to affect even biologically your brain and your body. So the amygdala in here becomes persistently active the whole time. The frontal cortex becomes hypoactive. So what we need in reality is that the frontal cortex needs to be more able, so to be more active than the amygdala, to control the amygdala. So people with anxiety, the amygdala is very highly active, and the frontal cortex is not able to tame the highly active amygdala. So working memory is disrupted. That's why it becomes, people become very forgetful, impaired attention, impaired emotional regulation. People become very impulsive. Reactive aggression becomes easily aggressive. Increased risk-taking behavior, impaired judgment, decreased empathy, and prosociality. This is all really a result of stress and anxiety. Of course, when we look in the DSM, we find a number of anxiety disorders, but all of them basically, they have almost the same biological reasoning, in which there is really the amygdala is hyperactive and the frontal cortex is not active enough to control the amygdala. And here, this is, of course, the role of some of the medication we have. But however, the first line treatment is psychotherapy. It is CBT, in which that CBT itself basically provide the tools that we need to override this hyperactive amygdala by the frontal cortex. So we retrain the frontal cortex to able to tame and control this hyperactive amygdala. And this is basically the role of psychotherapy and CBT, which is first-line treatment for anxiety disorders and a number of mental disorders. So in summary then, those are basically, the references, and again, this, the whole lecture is recorded. And Dr. Fidjar, she can distribute the slides to you guys. So in summary, again, the idea was to give you an idea about how we're really not in control of many things, especially mental disorders. So unfortunately, we still have a lot of stigma about people having mental illnesses, about having depression or anxiety. In reality, it's not a choice. People never choose to have anxiety or depression. People do not choose actually to become obese. People do not choose their interests and desires. People do not even choose whether they like coffee or tea. Just mind you, having an illness, or they don't even choose whether they get treated to a specific treatment or not. So in reality, yes, we believe that we are in control. However, consciously we're in control of some things, but in reality, most of the things are shaped by our genes and environment. So with that, thank you. And we can open the floor to some questions, comments, and all that.
Thank you, Dr. Abdul Mohsen. It's been quite frankly, a brilliant lecture. And I think if we stop screen sharing, I think what we'll do is that we'll have a discussion. Is that okay with you, Dr.?
Yes, let's do that.
Brilliant. Thank you. I'll just open it up. Okay, any questions, ideas, or thoughts for Dr. Abdul Mohsen? Just unmute and then you can give us a talk. We have a very quiet audience today.
Yeah. I don't know if it's how do we know if someone has a question actually?
And they just unmute themselves and they talk.
Oh, they unmute. Okay.
Yeah, could even raise
Dr.
their
Abdul
hands.
Mohsen, I just want to thank you for pointing out the positives of ADHD. It's nice to hear it every now and then.
Yes, yes.
Thank you, Abdullah. I thought it was really quite interesting what you said about children with attachment patterns. Something that we don't really think about in this society so much.
Absolutely. Interestingly, it's exactly the same thing. When we were, I mean, I was in a public school, and looking back, I mean, to the amount of bullying that we used to see, and interestingly, even, I mean, the amount of, if I go in time, I would honestly diagnose a number of the kids in school with ADHD. And this is exactly what I'm seeing in my clinic, by the way. The amount of ADHD is quite common in this country, especially I think of the relative marriage and all that, الزواج and all that, right? So it's very common, and it's also, I mean, easily misdiagnosed. They think you start blaming the kids that they're just, I mean, being violent and all that. In reality, it is a mental illness. They do need treatment. يعني في الحين شوية يمكن صار بعض يعني الاويرنس بدا يصير، ولكن ايضا ترى مو للمستوى المطلوب حقيقة.
Hi, I have a question.
Yes.
So the case of obesity, or like, let's say children not being able to control what they eat, is that like therapeutical? Is it for therapy, or is it علاج كدواء, or how do you go to past traumas, or what do you think is the حل for that?
So good question. So it's a number of things, of course. That's why it's important that a person with obesity need to see a physician or see a dietitian for that. So they need to do a number of tests. It could be a problem, again, with thyroid. It could be, as we talked about, leptin resistance and all that. It could be a number of things. So a number of medical problems actually cause obesity. And then they will see, for example, what's really mean, how to manage this obesity. So again, it's not just diet and exercise. There could be some underlying issues down there that
like
need to...
mentally, you mean mentally, not like just, no, it's physical with thyroid and all that stuff, but it's also mental, that they cannot control how they eat, or they go forth to food faster compared to other children.
So it can be mental, it can be psychological, and the conditions, again, with anorexia, for example, but not obesity or bulimia. Mm-hmm. So, and also, I mean, some people, they do tend, it becomes a coping mechanism. So whenever they're anxious, they become to overeat. So that's a way of, you can control it with CBT, with sleep therapy, if some patients do have that. So it can be absolutely.
Thank you, doctor. Thank you, doctor.
Talal has a question. Talal, you may go on.
Hello, do you hear me? Is my voice clear? Can you hear me?
Hello.
Hey there. Thank you for this nice lecture. I will ask this usual question. What do you think about the relationship between the free will and law? I mean, if we were to say that people are current in full control of their deeds, how would we hold them accountable? How can we hold them accountable to the law? And thank you again.
I think it's disconnecting, probably.
It's disconnecting. You could type your question in the chat if you like, and then we can just pass it over. We have 3 chats.
Yeah, I think I know what you mean, Dr. Talal, about, I mean, criminal responsibility and whether to take that in consideration about the biology and all that. It's again, I mean, this issue is still debatable all the time in forensic psychiatry and psychology. I mean, the same thing with psychopathy, right? So do psychopaths, for example, choose to become psychopaths? Do they choose to have, I mean, small amygdala and hypoactive? Do they choose to have, I mean, a small frontal cortex and hypoactive? Of course not. They don't choose that. However, they choose the act itself. So we punish the act. We don't punish the intention. That's why the law itself, you cannot, I mean, punish someone for their intention. But the same thing, for example, with pedophiles, all right? We punish, I mean, the act itself, but the desire is there. So even, for example, when we treat pedophiles, we chemically castrate them. We give them some medications, for example, Lupron, that eliminates their sexual desires or their urges, right? In reality, the interest is still there. So they do have still, I mean, the interest. I mean, we cannot control that, right? But we're controlling their actions. And this is basically what law is. I mean, law is, again, is concerned about the actions, not the thoughts or desires or interests. Did I answer your question? Well,
Yes, you did. Yes, you did. Thank you so much.
Okay. Can I say some comments about this lecture, please?
yeah, Dr. Fadl.
Yes.
Fadl.
Yeah. Thank you. Okay. Thank you very much, Doctor, about for this lecture. Yani, all these ideas, I really believe on them, and I think you put them in words in a really nice and a good way. I really couldn't express my thought the way you expressed it in this lecture. So I really thank you about this great lecture. I really have. I just wanted some. I just wanted some comments about the whole idea of free will. I know, like these type of questions really hard to answer, and I like this what like David Chalmers, the philosopher, I think this Australian philosopher, he said about like these are one of the hard questions that people will never be able to answer, and really it's difficult to approach and find some convincing answers, but what you did in your lecture, it was really great job. I really would like to thank you about it. One time I read a study about these kind of lectures when people talk about determinism and how we have a low control on ourselves, especially on our brain. So there are some studies about these kind of lectures they tested, and they gave the students some of these clips about lectures the way talking about determinism, and then they gave them some moral questions and moral dilemmas. And what they found that people were exposing to these kind of lectures, they are really thinking they don't have really control, and they kind of choosing some selfish choices. So they were to talk about really, it's really dangerous to distribute these kind of lectures or these kind of thoughts. But it's really, but this is the truth, and this is what studies really showing, and we have to put out this information to the public.
So you mean they're not? I mean, like sharing those lectures in what way they're dangerous, as you framed it?
It's
like...
okay. There there are some studies about we really don't have a free will, but we have the illusion that we have a free will. So and this illusion of having a free will, this is what controls society. And plays really a major role in controlling societies. And and these students, when they were exposing to some clips about lectures about determinism, and people really they don't have a full control of their thoughts or their acts, and then they expose them to some moral dilemmas. So they were more liberal and more choosing some selfish choices, more taking risks, and not really considering.
So interesting. So you're right. So interesting. I think if from what you're saying is that, I mean, if we raise that issue more openly, people will use it as an excuse, for example, to commit crimes or be violent, and that to say, well, it is really in my genes or my brain.
Yeah.
In reality, it's actually not. There's a number of studies showed, even for example, the same thing with violent games, right? I mean, we always ask the question, do, for example, playing those violent PlayStation games or Xbox games and all that make kids more violent? In reality, no, they don't. They do, yes, in already violent child, or already violent, for example, like a person who's already in a violent behavior in family. So when violence, for example, is praised, then yes, I mean, violence, watching or playing those games will increase. However, if we make, for example, a kid who is really been doing well in school and all that, there's nothing wrong with him, and then let him play violent games, that doesn't mean he's going to become a criminal. So in reality, and this is basically what we talk about, the environment. So yes, I mean, those issues, maybe they influence, however, they influence the already people who are really, I mean, prone to use violent measures and all that.
Yeah, of course. And also one more thing that you're kind of emphasizing on the biological factors that causing people not to have a fully control or not really have a free will, and if we can say that. But also, it's good that also you talked about some of the environmental factors and the social factors. And also they are playing really a major role, maybe equivalent to the biological role in controlling our behavior and not giving us much choices in choosing our own behavior. So it's really taking us to the knowledge that we really don't have control overall on any aspect of our life. I know maybe this is kind of interfering with the law and responsibilities, like Dr. Talal what was asking about. But still, I really do believe that we have a really, it's not like we have very less or very low level of free will. I really don't think that we have a control at all on every aspect of our life. But at the same time, I really do believe that we have some sort of, not a free will as much as a free want, this idea about maybe we don't choose our acts, but at least we can stop us from doing some sort of some reactions, which is kind of like our behavior.
Yes, that's what we call, we don't have a free will, but we have a free want.
Yeah.
Well, meaning that, for example, yes, I do not have control over the desire, but I do have a control over what I shouldn't do.
Yeah.
Right. Yeah. So I don't have a free will, but I do have a free want.
Yeah. And I think this is it's really good that you mentioned the role of prefrontal cortex, because over there we have like the anterior cingulate cortex, which play a major role in controlling our impulses and controlling our reactions. And this is the way that maybe people start to think on free will. It's not that we choose our behavior or we choose our reactions. It's happening, but we have some sort of level of just controlling or minimizing the impulsiveness. And this is where like the role of like CBT, and you talked about in CBT here where we can increase our control or harness the impulsivity that usually the other part of our brain might take us to some choices or some bad behavior.
That's true. Yeah.
Yes. Well, thank you very much for this really great lecture, and thank you for giving this opportunity.
Thanks. Any other questions or comments from anyone?
Oh, it's been a great lecture, Dr. Thank you so much.
Okay.
And thank you for your patience. It's been great. I'll send you the يعطيكم العافية everybody for coming. ونشوفكم على خير إن شاء الله.
شكرا للجميع. Thank you.
شكرا. مع السلامة. Bye.